Hello, Found Family. It's such a privilege to be with you. As a family doctor, as a medical doctor, I can't tell you during the past several weeks daily how many communications I get phone calls, emails, text messages, and through even social media. And you've asked about my opinion about coronavirus or what currently globally as a zeitgeist we're and community we're working through. You may not know, but my background is in microbiology and medical technology before even going to medical school. And so this area of microbes and virology, viruses, the study of viruses, it's something that I've spent quite a few years in a laboratory as well as didactics, studying it and looking at it and culturing viruses and understanding how they operate. See, Louis Pasteur, perhaps the father of germ theory to some extent, um, after Robert Koch, he basically on his deathbed, it is known that he said it's the terrain and not the bacteria. What he was talking about is really the pre-critical terrain. What he's talking about is that it's far more important, the particular disease that a person has, um, than the person who has the disease. The person who has the disease is paramount than this particular virus or that particular infection, this particular pathology, and so forth. So, what is it that I'm saying? If you were to continuously worry about something, what that does, we know now, research has shown that that lowers your immune system, that lowers our NK cells or natural killer cells, the macrophages, and this sophisticated orchestra that we refer to as immunity. However, if you are aware of what's occurring outside of you and you choose to relate to it from a place of calmness, from a place of groundedness, where you are aware that life protects itself, that we, including the viruses and the bacteria, we're part of the larger conversation. That when you're looking at your own life, if there is an area that you need to clean up, clean it up. If you need to eat healthier, fine, eat healthier. If you need to hydrate yourself, hydrate yourself. Drink more water. If you need to increase your physical activity, increase your physical activity. There's simple things that we could do short of regular personal hygiene of taking shower and washing our hands and washing the nasal mucosa of our nose. There's simple things that can be done. Every single person has a hair dryer. Even if you're traveling in a hotel, you can have a hair dryer. Do you realize that research has shown that just holding a hair dryer at a comfortable distance away and having it on warm air and just breathing that hot air through your nose will increase the temperature of the nasal cavity that will kill off various different viruses? And coronavirus is not any different than it being a virus. So these are the things that you could do. So I thought instead of coming in with a particular supplement and advocating that everyone should take this supplement and you should put yourself on auto order, I thought that we could have a conversation and create a linguistic abstraction, create a context which is far more healing than taking supplements. I recommend supplements. I don't have anything against them. Obviously, there are things that can be done to boost up the immunity, to boost up the migration of white blood cells, the movement of white blood cells into our system, into our serum, increasing the lymphatic system and various different things. Of course, it helps and it can be done. And to some extent, if there are medications that's required and it's needed judiciously, it can be done. But coming from a place of groundedness, coming from a place of loving, coming from a place of flatness, coming from a place where we are contained, then we don't really use coronavirus as the latest distractor to distract ourselves and to busy ourselves with things that only create worry, and it creates anxiety, not only for ourselves, but for everyone around us, including our loved ones. Do you realize that simply taking 12 breaths, 12 breaths, did you know that it lowers your cortisol level, or the aspect of cortisol that can lower your immunity? Can you consider that? Can you see that by taking a deep breath, you're increasing the intrathoracic cavity, you're increasing the volume of your chest, and by doing that, you're increasing the blood flow into various different organs, including your sinuses. By breathing out the air, you're increasing the lymphatic system. How? As you breathe in and as we breathe out, we have this incredible muscle that's referred to as diaphragm. As you breathe in, you flatten the diaphragm. You actually activate different parts of different nerves that they're coming off of the spinal nerve, and they go inside various different visceral tissue, including our lungs. The deep breaths will activate, and the way that you breathe will activate and will create various different vasodilators. These are chemicals that they increase the diameter of vessels, such as blood vessels, that they go in there. Did you know that simply doing this, simply doing that, look again, if you were to repeat this yourself wherever you are, you notice shortly after you do this, you will start getting an itch. Do you know why that is? Because when you do this, you release various different chemicals, including nitrogen oxides and various different things that they are vasodilators. Whenever you increase vasodilation, one of the things that you do is you increase blood flow. And I'm here to tell you, as a medical doctor, wherever blood goes, infections are handled. So, the whole idea of being with you on this Instagram post is to have you consider doing specific things, the ones that we've talked about, or the ones that you most likely are doing. I'll never forget when I was in India, and one of my professors used to say that the sunlight is the greatest antiseptic. And back then, we were working with patients with leprosy, and we would pick them up and we would take them outside, or we would lift up the curtain in their room and we would allow the sunlight to shine through. It's just stunning when we're looking at...
I'm sorry.
That's okay. Do you want me to repeat the lesson?
Yes, the sunlight.
Okay.
I didn't want to turn it off before in the middle of your talk because sometimes they beep when they're turning off.
Oh, no problem.
Please go ahead.
Oh, sure. I'll never forget when I was in India, one of my professors used to tell me, and this is working with patients with leprosy, and we would carry these patients outside into the sunlight, or we would lift up the curtain in their rooms. And my professor used to say that, you know, sunlight is the greatest antiseptic. And I would like to remind you that. getting out and getting some sun, even if it's 12 minutes a day, going for a hike, and actually coming out and having deeper conversations with people, having a deeper connection with your community, with family members, is far more helpful in boosting up your immunity and creating a robust organism that has this superb immune system than hiding and going in the cave and locking up and covering yourself. So these are some of the ways that we could support ourselves: hydration, paying attention to the food that we eat, increasing our physical activity, personal hygiene, a deeper connection, sunlight, nature, as well as frequent washing of our nasal cavity, and maybe even exploring the hair dryer technique as we've talked about, and taking supplements intelligently in a way that boosts up our immune system. God bless you. Please understand that every issue is an opportunity for us to polish our consciousness inside. So don't make the issue the issue. Make how you choose to relate to the issue what you're looking at. God bless you.